Well, good evening, everyone. Why can't I ever remember the date? Oh my gosh. Today is November 25th, Monday, November 25th. Thanksgiving is just around the corner. I am Nurse Charms with the beautiful Dr. Grace. It's always a pleasure to be live with you. How are you feeling?
No, I'm not going to tell a fib. I have a food hangover.
Oh my Lord.
There is a such thing. It was my granddaughter's birthday weekend, and I ate stuff that I don't normally eat. And I feel just like I had some alcohol. My body is aching. I have a headache. I'm hydrating with some electrolytes.
well,
So, yeah, there's a such thing.
well, at least you having a food hangover as opposed to, hardcore drugs, right?
Right, right, right.
Yeah, yeah. So, tonight I want to discuss medical emergencies.
Mhm.
Yesterday I was on social media and I came across this clip of well-known bishop. His church is in Dallas, Bishop T.D. Jakes. And just full disclosure, I don't know him. I haven't attended his church. Um, so this isn't to promote or to tarnish him. Either way, this is just to give a fair discussion from a medical perspective of how you handle what to do in these medical emergency situations. So I wanted to chime in on this topic because actually I had a patient um, prior to this week, and he was having some of these same symptoms. What it appeared, I mean, we can only just visualize,
Mhm.
like, oh, what may have happened. We don't know. The church did release a statement saying that he had they're calling it a medical incident, and then they're saying that he's in stable condition. So other than that, we don't know anything else. So I
Mhm.
don't want to portray myself as having some secret information tonight about Bishop. My prayers go out to him, as they will go out to anyone in this situation, because, as a nurse, I care about the patient. I don't care about what anything else. I take care of
Mhm.
prisoners. I take care of, you name it, doesn't matter. It's all about getting this patient well and on to that next step. So we just want to, this, excuse me, this was so unrehearsed. I just hit up Dr. Grace. I texted her earlier today. So have some grace. All the viewers out there, have some grace. Ha ha, corny joke. Nah. But have some grace with us, because we're just kind of discussing this, giving our opinions about, what from our perspective could have potentially went on in this
Mhm.
situation, how some things could have been handled better. um so we're just basically gonna have a conversation about that, and then get into, we'll name like some things in general, medical emergencies in general, that we see a lot with patients, and or just in the community, how you would go about handling that. So I guess that's the basis for our show tonight. Sound good with you, Dr. Grace?
It sounds great. Do you guys know we have over 50 years of experience combined on live tonight? And
Oh,
it's always an
don't
honor.
be
It's
telling
always an honor to work with you, talk, just talk about these
my age.
matters and these topics because people need to know what to do, especially going into the holiday season. People are
Right,
getting into gatherings. What do you do when somebody chokes? What if
right.
somebody faints like he did? Do you know as another human being? You don't have to be a doctor, you don't have to be a nurse, you don't have to be a paramedic or anything to provide safety for someone that is having a medical episode right in front of your face. So as easy as A, B, and C. I guess we could start there, right?
Right.
Airway, breathing, and circulation. So you want to make sure that their airway is clear, and that's just by looking, listening, and feeling. You want to make sure the air is coming out of their nose and out of their mouth. Um, and you want to make sure that their airway is open. You want to make sure they're not choking on a meatball or something like that. And then there's so much information out there now and so many videos where people can watch even the Heimlich maneuver. And there's so many gadgets now to open the airway from someone's choking now that is available out there. So everyone should, under the sound of my voice, should have a first aid kit in their home, blood pressure kit, thermometer, a pulse oximeter. If that virus didn't teach us that some years back, everyone under the sound of my voice should have one in their home. That should just be staple in everyone's home, and also a first aid kit in your car. But again, when somebody is fainting, what do you do? So first of all, stay calm and
Right.
make sure everyone is not crowding that person. And if you feel confident, take charge. While you're making an assessment, make sure you have your phone out, video recording. That
Right.
part,
Right.
you should have your phone out calling 911, telling them what's going on in the midst of that situation, because timing is of the essence in that moment. And so, one of the things that I saw in one of the clips, he was sitting up in on a stool. I think he was.
Right, right.
Yeah.
He was sitting on a stool. They said he had preached an hour-long sermon, so this
Hmm.
was kind of towards the end. And then from what I saw, in my opinion, it looked like he just kind of froze up for some reason. You know what I'm saying? This is
Right.
all my opinion, just based on, speculation of what I visualized, just like anyone else can watch the
Hmm.
video. And just out of respect, I wasn't going to show the video on the screen
Right.
because it is a little bit disturbing. I just think if that was my family member, and see them in, kind of a compromised, um, position with their health and stuff, nobody really wants to broadcast that. But you guys can go on TikTok, you can go on, YouTube. The video is everywhere. Google, wherever, you'll see the video that we're talking about. Bishop T.D. Jakes, where he just had, they're calling this medical incident. So what I saw is it just looked like he kind of froze up. So earlier this week, well, last week, I actually had a patient I was taking care of, and he ended up was having a full blown heart attack in front of me, and he kept telling me that all he kept saying is like, my chest hurt, my chest hurts. I'm like, can you describe it? Because there's different type of pain. There's cardiac pain, and then there's pleuritic pain, from your lungs, like if you have a cold or something like that, a lot of congestion, and you may be having some pain in your chest, but that's mostly toward for your lungs, not your heart. So if you're having heart pain, it's a little bit different. So I'm like, does it feel like a pile of bricks on your chest? That huge pressure, because what's happening is the blood cells aren't getting oxygenated blood, so they're just like closed off, they're not getting the oxygenated blood, so that's what's causing that pain, that heart attack pain. So I'm like, oh my gosh, you're having a heart attack. And so I'm like, and the biggest thing that people have to realize, because sometimes, and again, I just want to repeat so people know, like, I'm not saying that Bishop TD Jakes had a heart attack. I'm just saying this is what it looked like potentially to me. But you're going to give your opinion also, and I'm just relating it because literally this is what happened with my patient earlier this week. So it was the feeling of bricks, a pile of bricks on his chest. That was the classic. He just kept clutching his chest. And so in that situation, everybody needs to understand that time is muscle. The heart is a viable
Hmm.
muscle, so if it's not getting that oxygenated, tissue is just dying and dying. So the only intervention that you really can do, if you have aspirin, you want to pop an aspirin, because that's
Hmm.
going to act as an anticoagulant, so like kind of thin your blood out. So if any of your arteries and things are clogged off because your cholesterol is high or whatever's going on with your heart, so that will help. We tell a lot of patients, take an aspirin, and go to the doctor ASAP. And but the intervention you need is to be able to go to cardiac cath, and then they need to insert some hardware into your heart and look around and see what interventions they need to do. But mostly everyone having a heart attack, that's the number one thing you got to do. You got to get to that hospital. So don't go lay down. A lot of people be like, oh, I'll just lay down, and no, it's going to be worse, or you can even die. So heart attack is something very, very serious. You got to take serious. And my biggest thing is, I felt like the bishop, not trying to accuse him or anything, but he didn't really say anything. He just sat there. So we don't know what it could have been. Maybe he could have just been tired. Who knows? I think I've heard some people say that he overheated. So again, this is just all allegations. The only thing the family or the church has put out is that he's had a medical incident. So we still don't know. We're just kind of basing on what we see. So somebody else said, we really don't know what it is, but the important thing for anyone out there, whatever symptoms you're experiencing, never be afraid, embarrassed, or just help. I need some help. This tell me,
Mm-hmm.
tell us what's going on. You know what I'm saying? Like, I'm losing my vision. I'm just throwing out
Mm-hmm.
some stuff there. So yeah, what was your take when you saw, him just kind of, because
Mm-hmm.
he was preaching, he kind of slowed down
Mm-hmm.
talking, and then he just kind of like, whoa, like that.
Well, and you do this too, as when you do your evaluations on your patients, we have to come up with what we call a differential, which we think would be the most high probability of what's happening to the lowest. So, based on me just visualizing, I didn't do an exam, I didn't get any history or anything, but based upon the clip, and I want to give you kudos to being very respectful in the privacy of the family in that situation, not repeating the video. Kudos
Yeah.
to you. See, that's why I like to work with you. Very ethical. And so anyway, I would say heart attack would be number one on my list, based upon his habitus and what he looks like, being overweight and things like that. Number two, possibly stroke. Because he wasn't verbalizing, and sometimes when people have strokes, they can't talk, they can't verbalize. And then number three on my list would be a hypoglycemic episode where his
Mhm.
sugars, he preached for a whole hour. I'm quite sure he
Right.
burnt up a lot of glucose and those glycogen stores, so his sugar could have dropped. And it can mimic being overheated because they become diaphoretic, they can't speak, that type of thing. And then my fourth and last one would be something in the seizure category, because
Yeah.
people can have seizures, what they call, they don't have to convulse. They can have petit malls, or what they I can't what is the one where they just stare? I can't think of it right now, but there's a seizure where they just stare. And then if he did have, on my higher differential, if he did have a stroke, to say, you can throw a clot that can trigger a seizure.
Right.
So those would have been my top 4 to 5 on that situation that was there. And being that I am in ministry too, we are working on putting things, because our church is pretty huge too, so
Yeah.
we need to have people that are what we call armor bearers, security. We're doing training now and looking for donations for AEDs, because they need to be throughout the whole mega ministry. I mean, it
Right.
can't just be in one place. It may be too far. You need one on the stage, you need one in both bathrooms, you need one in the foyer, you need
Right.
wherever there is a group, especially if you have a huge sanctuary as the Potter House, they should be strategically placed every so many feet for someone to have access to get to right away, because it's very easy. The machine will just talk to you and tell you what to do. But
Right.
even in that situation, it would have gave them a whole lot of information right then, as me and you were talking about before we even got started, whether or not it was the heart and that he need electrical shock,
Right.
because especially if you're not medically inclined and you're not a doctor or a nurse, and that AED would have gave them a lot of information right there very quickly.
Right, right. Because one of the things I saw was so many people crowded the stage. And I mean, I understand people were just trying to be as supportive as possible. And that's probably what you were saying at the beginning, just kind of keep calm. I did see people just keeping calm, but it also seemed like people were just kind of frozen up themselves, like, oh my gosh, like what to do. You know what I'm saying? And sometimes, real spiritual people, I am a spiritual person, we tend to think that prayer, you can just pray, pray, pray. That's good. But I feel like it should have been more people move, because you pray and that's good. Prayer is in the spiritual sense, but then also in the natural sense, we got to do some stuff. You know what I'm saying? Okay, we just saw standing around, like you said, go grab the AED. Did somebody call 911? Let's help lower him to like a recovery position. We don't know, if like you said, the blood sugar could have been lower. Did he have a little seizure, or is he having a heart attack? He's not speaking to us. Let's lower him from this chair. And then I think that's kind of where the video cut out, and we didn't really get to see like all the after effects, which was good because all that stuff shouldn't be on live anyway. But yeah, but in like these situations, just like having all these people just kind of congregate and just kind of be standing there, like that really doesn't help. More people need to be, somebody needs to just start delegating stuff. Can you get this?
Right.
Yeah, anybody got some aspirin? Because like I was saying, like aspirin can help. Anybody got some nitroglycerin? You just never
Hmm.
know what people may have. And I mean, I don't know. Let me maybe pull back from that because you're not supposed to be sharing medications and stuff.
Hmm.
But I mean, Tylenol that would be over the counter, but nitroglycerin is a
Right.
prescription, so you would want to share that. But I mean, I don't know. But yeah, so let's talk more about like, okay, so because I kind of talked a little bit about if it was a heart attack. So what if it was a stroke? So what if it was a stroke and then just like his whole right or left side just went paralyzed? So then how should people respond for that?
Well, there's two types of strokes now too. So there's one where a clot is being thrown that blocks the blood vessels, so blood cannot get to the tissue, and then that tissue lacks oxygen, and then that's a stroke. And then you have one where the blood pressure is so high that the vessel bursts, where you actually have a bleeding stroke. So there again, there's a lot of videos that people can watch about the facial twisting, the facial asymmetry, not being able to speak. You can actually see
Mhm.
the limbs go limp, those type of things. And in those instances, you have to be careful. You cannot give aspirin then
Right,
because it could be a bleeding stroke. Now you gave an aspirin, now you're increasing bleeding, right?
right,
So those are the type of things that I really do believe, especially people that work closely around him, his armor bearers, his security. I know people are kind of like secretive and don't want everybody knowing their business. No,
right,
if you have some health conditions, you need to let your security team and staff know. And
right,
so when things like that happen, if you do have medication that can be administered, they're ready.
right.
And I think
Absolutely.
every security person and armor bearer needs to do a basic life support class. I
Yes.
mean, not just only for the leader, but wherever you go.
Right.
For
Everybody needs to be able
Yeah,
to administer first aid.
yes,
There's no reason you don't have to be a medical provider to
right,
know first aid. There's basic training that you can get. And yeah, everybody needs to be able. And again, we can't really assume maybe those people around him did know first aid, and maybe after
right.
the cameras cut off, some of them did administer first aid. But I don't know, just from a perspective, it did seem like everything was moving so slow, just
I
knowing
wanted to
that.
say that, but yeah, it was like almost like it was in slow motion. It was like, okay, is anybody seeing what I'm seeing? I mean, he's like, if the only thing he didn't do was fall over.
Right,
I
right,
just was expecting that to happen because it was just like in slow motion. But at that point, if there were people around him, and if he did fall over, then they could have got him into a recovery position. Would you want to explain to people what recovery position is? Because sometimes we as medical professionals, we think everybody know what that means. So you want to
yeah.
describe what recovery position is?
So recovery position, that's basically after the medical incident has concluded. So after they've had their seizure, then you want to turn them on their side, so if they have anything drooling out, if you happen to have some oxygen, give them some oxygen if they're having some trouble breathing, it's doing all those little things to help them get more stable. Not so much recovery is going on with a heart attack and stroke,
Mhm.
because I mean those are serious, like almost life or death. And at that point is normally either you're going to start with the CPR, doing because if
Mhm.
somebody's heart stopped, you're going to have to do the CPR. Well, I guess I can't say it would be the same thing,
Mhm.
um once their heart, so say their heart did stop, and then you do the compressions, and then you're able to successfully restart the heart, then yeah, you would go into recovery with that, and then that's the same
Mhm.
thing, just if they need oxygen, keeping them oxygenated until the EMS or whoever takes over next.
Right, right. And again, like you said, delegating. I didn't see anybody's arms moving like you do this or somebody was
Yeah,
dialing. Not saying somebody was not. We just didn't see it, to be clear on that. I'm
right.
quite sure some people were calling 911, probably was getting multiple calls from that location. But
Yeah,
yeah, there should have yeah, we need to be able to execute those type of situations, and not when they happen, we need to be in ready mode. And another thing I want to put out there too, being part of a ministry for almost 30 years, you have to stay under the Good Samaritan Act. And that means that you
yes,
can't have a medical team that's on schedule, because now you open up a whole door of liability, because you have like basically a hired staff that you have up and ready to say that they are capable and willing to provide medical, services or in urgent situations like that. So just have people on standby, let them be volunteer, nothing on schedule or on, like Sister so and so, Nurse Charms is going to work on the fifth Sunday. No, can't do that. Nurse
right, right,
Charms may be there on the fifth Sunday and she's volunteering her expertise if something goes down on fifth Sunday, but she's not on schedule, she's not working. So those type of things that we have to be mindful of, and things of that nature too. And even, old school nurses that provide services to leadership by giving them drink of water and handkerchiefs and stuff like that. All those people need to be BLS, basic life
right,
support certified. I mean,
right.
that's what should be, not just cute in their little serving outfits.
Right, right. And another thing that people need to keep in mind is that if you do have a medical condition, like, they have the bracelets and stuff you
Yeah,
can wear, because some people may not want to be revived or whatever,
right.
or just have all that information handy, like in your cell phone, in your purse, in your wallet, or just something, because I'm sure if something was to ever happen, that's the first thing people gonna be like, okay, can we get in this person's phone? Can we get in this person's pocket? Not trying to be, intrusive or
Hmm.
anything, but it's like, who can we contact? Because if the person's unresponsive, then you have to be able to, what kind of medications or and stuff like that. So it's kind of nice to just have that. I know people don't really think of that, but yeah, if there's ever a life or life threatening emergency, and people need to know stuff about you, it's nice to have, some type of organized list, and all your medications that you may be taking.
Right.
But I guess that's not so realistic, because the average person doesn't really keep that stuff around. The people who do that be like the elderly people that come into the hospital. They have all their little stuff all organized in a little list. I remember my
Hmm.
mom, bless her soul, she had all her stuff, written out on a little sheet. But younger people need to do it now. I mean,
Yes.
something could happen to me, and yeah, nobody would know anything. So I think those are just ways to really be prepared. And it's not a sense of gloom and like, oh, I don't want to think about doing that. Well, you should, because,
Mhm.
the more people are prepared, the better they can take care of you, or if you have
Yes.
a hospital, Lord, I don't care what happened to me. Do not take me to this place. Like, let me stay on the ground and go to heaven before you take me to that hospital. I mean, it's some people that think like that too.
Right. One of the things that you said about cell phones, one of the things that I educate my patients on, you should have a person in there, and ICE should be next to their name, ICE, the mnemonic ICE, in case of an emergency. That's the person that should be your contact in your phone. And, now I highly recommend too that you allow people, not just your passcode, you should allow facial recognition or one of your fingers,
Yeah,
because if you can't talk, we can't get in your phone and we don't know who to call. And then
right.
another things that I tell a lot of my seniors too, because a lot of them on medications, you know how they staple it to the bag,
Hmm.
those little things are perforated. They can rip those off and they can put them in their little wallet, or some
Yeah,
of them are even stickies. You could take the sticky and put it on a piece of paper and have it folded up in the wallet, or in a purse or something like that. Because if something has happened where you can't speak for yourself, they're going through all your phones, they're going through everything. They're going through your pockets, they're going through everything, so who they can call if you're on any medication, because they want to be able to provide informed care for you, because they don't want to give you something that's interacting with you, or something that you're already on. So that is very, very important.
Right. Let's talk about let's see, so we talked about stroke, we talked about heart attack, um, let seizures. Let's talk about what do we do if what do people do if somebody just stops breathing? I mean, say you could be just out anywhere and somebody just stops breathing. They just stop talking and they just stop breathing. Let's let's talk about some things for that.
Well, again, it's like airway. So why did they stop breathing? Are they choking on something? Is their airway clear? Is their airway blocked because of positioning? Because I hate to say this, because they're sexually pleasingly plump and they have a fat neck. All of those things that we have to take into account and evaluation for that. So that's the airway part. So you definitely have to assess the airway, and they call it look, listen, feel. So you have to look and see if their chest is going up and down. Listen, you might want to put your ear close to their mouth and then actually feel. If you feel anything coming out of their nose or even their chest going up and down, those are the way how you assess breathing. And if they're not breathing, you have to position them in a position where the head is, again, you guys can YouTube this, go on a video for sure, and just see how to actually hyper what is it, hyper extend the neck.
Mhm.
Yep. So the jaw is a little protruding forward, so that airway is open. So those are the things that you can do when you see that someone is actually not breathing.
Yeah, but then there's a lot of people that just with the whole COVID thing is puts a lot of people on, heightened uh I don't hesitation, you know what I'm saying, like,
Hmm.
and I mean, people, everyone should know that their safety, all, never compromise your safety for someone else.
Right.
If it's just all, it's one of those things where it's just a good Samaritan thing, like, if you're comfortable, like some people, they don't care, they just got that heroism, that passion inside them, that they don't care, like, I talk to some people, they'll give their, like, these are people who are like firefighters and police officers and stuff like that. Like, they gung ho with it. Like, they'll give their life for somebody. And I don't know. I don't subscribe to that. Like, my life has to come first. If I'm going to be in danger somehow, then it's not safe to do whatever, whether it's administering CPR, whether it's going after somebody, whatever. I would never tell somebody to, risk your life for somebody else. But I'm not saying it's a wrong thing. You just will go out as a hero. Some people want to be able to do that. But so kind of went on a tangent. But what about those situations where people, I mean, it could even be a friend, and you might just kind of feel comfortable, like, I don't know that I would want to give this person CPR. So what are some things that they can do in the meantime to help that person?
Well, first of all, you said it. You said it. You said, you got to assess what you're most comfortable with. Again, I don't know, it's depending on the situation and circumstance. If you just out somewhere, that's why it's important to have a first aid kit. And in those, they do have things that you can protect your mouth, protect that person's mouth, and protect you as well. But again, you have to assess to see if that's something that you're willing to do. And basic life support has changed drastically. You have to give compressions before you even give a breath now.
Good.
Before it was 3 breaths and then began compressions. Now it's 15 compressions before you do anything.
Right,
So
right. And
yeah.
yeah, I'm so glad they changed that. And yeah, that's kind of like a little trick thing. But yeah, I was getting to that. Yeah, if somebody's not breathing, then their heart probably isn't working either. So
Mhm, mhm.
9 times out of 10, that's how it is, right? Not breathing, no pulse, something with their heart. So I would just recommend, like, if they're not breathing, they stop breathing for some reason, you can't visually tell that they had some food, or like, or like if you guys have been hanging out for the last 2 hours and you didn't see them, they haven't eaten anything, then yeah, you would probably suspect, well, something's going on with their heart if they just stop breathing. So if you're uncomfortable with giving those mouth to mouth breast, and just go for it and start, call 911 and just go for it, and then just start with the chest compressions, because even then, one or the other, I mean, of course both, the combination is what helps to kickstart the heart. But if you at least start with the compressions, that can
Right.
at least help the person restart their heart, and then hopefully they can start breathing on their own.
Mm-hmm, mm-hmm.
Yeah, let's see. What are some other medical emergencies that we see, especially, just going into the holidays and stuff? Like, I keep wanting to kind of go back to the whole CPR thing. That, I mean, that is just so, so important. Like, just knowing, learning CPR, going to get certified. I wish that they would have free classes, but I mean, people got to make money. I don't know if the government can offer it, or I don't know how all that works, but I just wish that everybody on everybody walking this earth knew CPR, because oh my gosh, that would help. Because if you just think about it, when you call the EMS, I mean, that's going to take time. If you're in a small rural
Mm-hmm.
city or something, that's going to take time. So, I mean, if you know somebody, if you trained in CPR and you can start off with that, that helps. Like, how many stories have we heard where, just a
Right.
good Samaritan started CPR and it saved that person's life before the EMS even got there. So my gosh, I just wish that more people would take some CPR classes.
Yeah,
That would help a lot.
there was a running a debate about that. They were even saying that it should be even taught in restaurants and things of that nature. And then they were saying that, well, what if they quit? Well, at least they have a life skill that will help, that can help them wherever they go, even in their personal life. I
Right.
mean, that should be part of what people should, especially if you work with the public. The
Hmm.
basics you should at least be able to administer and be able to get 911 and delegate and have safe and effective and efficient care for someone who is in a compromising medical state, especially in public service. I think everyone should know from. I'm quite sure the airline stewardess and stuff know how to do that kind of stuff too. I would assume, but I've been on planes where they're asking, "Is a doctor on board?" And I'm like, "Well, what can't you?"
Yeah,
But
yeah.
though I think anybody that's dealing with people and to that magnitude should be comfortable in making those quick assessments.
Yeah, let's talk a little bit about overdose also, because
Yeah.
um have to admit that is going on. I mean, we hear about it all the time. I see it all the time. People overdose, and I'm talking about, alcohol. People get so drunk and pass out, and how that can turn into a medical emergency as well.
Yeah, people can throw up and aspirate and die. I mean,
Yeah.
yeah, they can do that. I mean, so if you know a friend that is constantly doing that, there needs to be some type of intervention going on there because that is not safe at all. And I'm quite sure they're self medicating something if they're drinking to that magnitude, frequently. So, step in regards to that. You got to have some type of situation there. And then, I do pain management. So I highly educate my patients on accidental overdose with opiates. And it's so funny. They like, I would never do that to myself. I said, they call it accidental for a reason. It's not like you intended to do it.
Right.
Some people just forget the last time they took a dose.
Right.
And then and I said, "Do you remember the last time you forgot whether you had to sit there and think whether or not you had a dose because you're in pain?" And they're like,
Right.
"Yeah, you're right." I said, "Okay, so no one is accusing you of being suicidal or wanting to hurt yourself. That's why they call it accidental. And then a lot of people around the holidays that are on pain management, take opiates. They want to party with the rest of their family, so they may be drinking a beer or may having some tequila or whatever. And I tell my patients, I wish you would not drink, but I hope the day that you decide to drink, you just leave your medication alone because I don't want you to go to sleep and can't wake up. And
Right.
so I also prescribe all my patients Narcan or naloxone, which is a nasal spray, and I have them every year to watch a video on how to administer it and tell them to show the video to their family members, because if they're out, they can't give it to themselves. So
Yeah.
they need to share it with their family, how to use it and where is it. I tell them have it next to your bed where you sleep. If there's a favorite chair where you like to watch TV and you doze off sometime, let people know where it is, in your car, in your purse, in your back pocket for men, whatever. I'm like, if you could keep that big old wallet in your back pocket, you can keep some emergency medication in your back pocket. But anyway, so those are the type of things that people need to know, that is real and that it can happen, and be prepared if and when it does.
Yeah, for sure. So yeah, just as we kind of wrap this up, let's talk about homeopathic medicine, things you can do naturally just to stay healthy and prevent, diabetes. Lord knows nobody wants to have diabetes, high cholesterol, high sodium, high blood pressure. Let's just talk about some things that we can do, nutrition
Mm-hmm.
and yeah. Oh, and also might as well just throw in cold and flu because it's that
Mm-hmm. It's the
season
time of the
now.
year.
Everybody's sick. Yeah.
Don't be ashamed to wear your mask. If you're going somewhere and you have a check in your mind or in your spirit that you need to wear a mask, wear it. If you're not feeling your best, but you know you need to go, be polite. Wear your mask. There's nothing wrong with that. Make sure you still have your hands. You should have hand sanitizer and sanitizing your hands anyway, even before COVID. You should have had that in your purse and put it on the table when you go out to eat dinner with friends and family and stuff like that. And even when you go to your family houses and stuff now, if they have a table spread out, it should be a bottle of hand sanitizer there before people start grabbing their plates and utensils. That's just being polite. So
Yeah.
and then just free stuff, drink water,
Right.
unless you someone that's on dialysis or have congestive heart failure, and you're water restricted. At least know how much you're supposed to drink, how much fluids you get in today. How about moving your body, exercising? I'm at the gym, so I can't tell my patients to do something that I'm not doing. Do you know, for every 30 minutes that you exercise, that you add 3 hours to your life? So could you please
Yeah.
do at least 30 minutes, and add some hours, some life longevity to your life? They said a heavy set person who exercise versus someone who's small frame and don't. The heavy set person have live longer than the skinny person in
Right.
regards to longevity is concerned. So, and then, like I said, the food hangover thing. I'm not saying that you can't deprive, have indulge in cake, candy, and ice cream and stuff like that, but just don't let that be part of your everyday intake. I just don't see how
Right.
people eat like that every day. I promise you, I was down. I mean, literally, like I need to do some work
It's
today.
it's
Today is my
com- it's
admin day. I need
it's
to get some
comfort.
paperwork done.
It's the comfort. I think it's the comfort foods. People love those comfort foods, bread, pizza, macaroni, all that stuff with all that fat and sugar. Sugar is the enemy. Oh my gosh, do not eat any added sugar. Processed foods, we can't talk about these things enough. They are literally the devil. But people eat them anyway. People have the mindset like, oh, well, I'm going to check out of here some way, so might as well enjoy myself. No, you don't want to think like that. Trust me, I see it every day at work. These people are going out bad. You don't want to go out like super sick with all these
Mm-mm.
different chronic illnesses. You can't even wipe your own butt. You got a breathing tube in your mouth. You don't want to go out like that. You know what I'm
Open
saying?
sores on their body that
Right.
won't heal, and it's a vicious cycle because you're not getting enough nutrients so it can heal. It's then
Right.
infection get
Being
in the blood.
overweight, obesity, you can't even turn in the bed or anything. You can't even walk. You can't even sit in a chair. I mean, you don't want to get to that point. Not judging anyone that's at
Right.
that point now, because things happen, life happens, and you can um change course even if you're already at that stage of obesity. But
Hmm.
prevention. I'm always on the side of prevention
Mhm.
because it goes a long way. I mean, you can't prevent, some things happen. You can, do everything possible. And I mean, eventually illnesses are still going to catch up with you somehow. That's just life. But, you want to just stay in prevention mode. And that's what I try to do every day with my life. I don't want to be out here telling my patients, oh, you should do XYZ. Then I'm behind some hospital in the parking lot smoking,
Right.
drinking and doing all these behaviors that will um lessen my lifespan. You were saying
Mhm.
about how we can exercise so that it can increase our lifespan. And that's what I want to do. I take my vitamins, I eat my
Mhm.
fruits and vegetables. And, I try not to eat those comfort foods, those processed foods and
Mhm.
candy and junk with a lot of sugar. I try not to do those things, drink lots of water, not these sugary drinks. A lot of
Mhm.
people like to drink wine, that's okay on an occasion. Sometimes people occasion is like every day. And it's like, come on now. Like you're only fooling yourself. We are not invincible. You know what I'm saying? So all this stuff that you be like, oh, cheat day, I'll
Mhm.
do this and that, it's gonna eventually catch up with you. I had somebody say something like, well, oh, you could just eat whatever and work it out. Nah, that's not how it works. That stuff still
Mhm.
sticks to your arteries. You know what I'm saying? So it doesn't
Mhm.
matter. That's not how it works. So, just prevention, focus on prevention. So you can hopefully avoid all these different medical emergencies that we were talking about.
Yeah, and so I just want to put out there too. There's a lot of natural things that you can do too.
Yeah,
I believe in pharmaceuticals too because I'm a medical doctor. I believe there is a place for that. But if you want to do some holistic stuff, I mean, there's holistic amino acids available now that are plant based. What we call the GLP-1s. I do photolight therapy that stimulates stem cells. That's non-invasive. There's just so many things that you can do to better, live. But at the same time, you have to work along with it. I'm doing all the natural stuff, but I decided to have some cake and ice cream and candy, and my body responded.
yeah.
It's not like I do it all the time. And then my grandson's birthday is coming up, but I don't think I'm gonna be eating cake. I'm not gonna be eating cake. I can't do it 2 weeks in a row. I am done. I
I
am
know. I hear you.
so you have to be disciplined, and then there's a lot of people that don't get me wrong, biochemistry is going on in your body or don't allow people to be disciplined. That gut and that brain connection, you probably need to get your gut together so you can be disciplined. Don't think because you lack discipline something is wrong with you, like bad, you're
Right,
just a bad person. No, there's something that's going on biochemically that is not allowing you to be disciplined. So, there's functional medicine doctors like myself that can help you with that so you can be disciplined. And
right,
so, and when you want to eat like that, you decide to eat like that, not because you have this constant nagging in your brain and in your gut to indulge in that type of thing, what makes you feel like you don't have the willpower. No, something is off and we can get it right. So, those are
right,
just some things there. And like I said, just normal stuff that don't cost you anything. Go to bed on time, get some
right,
sleep. Listen to your body. If like me, if I go to the gym every day and my body is saying, no, you need to rest today, I'm going to rest. You need to
right,
drink more water. Water is free. Drink the
right,
water, that kind of thing. Get some sunshine, get some fresh air. All those things are free. You don't have to spend anything like that. But people spend money on what they want to. We're asking you not to spend money you don't have. We want you to redirect those dollars on things that you're spending money on that is unhealthy and redirect them to something that is more healthy for you, because it's amazing how sometimes people feel if it's not covered by my insurance, I'm not going to do it.
right.
Okay, but you're worth it. You're
Right.
worth it.
And
Yeah.
yeah, and so like instead of buying these expensive gym shoes or purse or clothes or whatever, if your insurance doesn't cover you to get labs, pay for it. It doesn't cost that much. You can go get,
Hmm.
basic metabolic panel, find out your complete blood count. You can get those
Hmm.
things. And, as we talk about prevention, you want to know. Matter of fact, I'm just going to put it out there like everybody should know what your levels are like. If you haven't had any of that stuff checked out in like more than 2, 3, 4 years, and if you're not on a healthy diet, or if you don't have healthy habits, you need to stop what you're doing right now. You need to make an appointment. You can hit up Dr. Grace, because
Hmm.
he will definitely get you on the right track. Make sure all your blood cholesterol is so important. You want to know what your cholesterol
Hmm.
is. You want to know what your H1, why am I drawing H1AC? H1AC, right?
Hemoglobin A1C.
Hemoglobin
Yeah.
A1C. Yeah,
Hmm.
H1AC. So you want to know what that is, because that determines if you're diabetic or not.
Hmm.
So there's so many different things we can do. Just we can diagnose just based on your blood levels alone. So if you don't know any of these, you want to go get that
Hmm.
stuff checked out ASAP. Make it your goal for 2025. Yeah, go get that stuff checked out. Just so you
Hmm.
can be healthy, because I tell everyone, and everyone should already know this, but your health is more important than your wealth. Everybody out here want to get money. That money ain't gonna matter if you're 6 feet under, and unless
Right.
you planning on leaving it for your,
Hmm.
offspring or whatever. But yeah, your health comes first. Everything starts with your health. So
Hmm.
that's why I'm always, try to take the opportunity to help keep people educated on these things.
Yes.
Yeah,
I want to say this too. A lot of there's two prices. There's an insurance price and a patient's price.
right.
A lot of people don't know that. They'll get the insurance bill and see thousands and thousands and thousands of dollars for their labs. That's what they bill your insurance. But if you don't have insurance and say, "Hey, I don't have insurance," there's a whole nother price list.
Right, a sliding scale,
And
right, for no time
it
insurance.
is not, it is
It's
not even, it's not,
economical, right,
it's affordable, but people have seen those old bills and think, oh my God, I can't do that, because of
right,
course you can't, because you're not the insurance company. But that's how they play the game. So don't sell yourself cheap. Find out, commitment and conversation. Conversation is not commitment. So at least get the information so you can make informed decision. You'll be surprised. You'll be able to afford it. For a CMP is not very expensive. A CBC is not that very expensive either. So a lot of people think that they're like hundreds and dollars when it's that's the insurance price. Let me just leave it at that. So, but
yeah.
anyway, well, thank you for having me. I just want to say this was cool. I'm glad I pushed
Yeah.
through.
Yeah, thank you so much for joining me. And viewers, thank you for being here. Please share this video. If you feel that you got value, please share this video. I'll be circling back. We'll both be circling back on the comments. So if you're watching this video on a replay, you can leave a comment and I'll circle back and I'll try to answer your question for you. And just everyone else, have a happy holiday. I'm going to try to go live more often. My schedule is so crazy, but I really enjoyed this. Hopefully, Dr. Grace will come back and go live with me. If something else is going on, I like to discuss this so we could just kind of keep people updated on, current things in health news. But see ya.
Okay,
Bye.
good night. Happy
All right.
Thanksgiving. See you.
Thank you.